Mimi shida imenianza kutoka mtoto wangu wa mwisho. Mimi nimezaa watoto 6, 2 wakafa, lakini yule wa mwisho ikaanza ile shida ya kuteremuka tu pande moja, hii ya kuume kateremuka tu, hata hiyo nguvu ya kiume sasa ikaisha kabisa, sina nguvu tena.
Our implementing partner Amref has been doing through our support with the county governments and oversight of the National NTD program. This is really with the focus to ensuring that the systems in place, the health systems in place, can be able to take care of patients that need the care, and these are patients who have lymphedema, and also those who have a hydrocele, targeting them, identifying them, and ensuring that they go through surgery so that they can improve their quality of life.
So the neglected tropical diseases are a group of diseases that have not been taken care of traditionally. So they have been neglected, and lymphatic filariasis being one of them. It's very common here in Coast, and we have seen a lot of it taking place. Regarding elephantiasis, hydroceles, and other kinds of edema. In Kwale, I think for the last decade there has been some activity and some partnership between the county government of Kwale and Amref. So a lot has been done, and the MOH in conjunction with Amref has sensitized the community. Mass drug administration has been done, and then went a step further to educate even the healthcare workers on what NTDs are and what LF is. So we've had a series of trainings for different cadres so that they can have a better understanding of what LF is. For example, this year we had training that had medical officers, clinical officers, dermatologists, and even occupational therapists, and also physiotherapists. And this was a holistic approach, even the psychologist, just to help the patient in the various aspects so that it's taken care of holistically. Besides that, the doctors were trained on the newer techniques of hydrocelectomy. So screenings of the hydroceles were done, and we had doctors from the University of Nairobi coming in, the lecturers coming in partnership with Amref, and we had doctors, anesthetists, theatre nurses, all trained on how to do the hydrocelectomies in the newer way, and there was even a retraining on the same. And so right now we are now doing the hydrocelectomies using the newer techniques.
Ndani ndio sasa, huku ndani ndio sasa kuna moto huko ndani, kuna kama pilipili hivi inawasha huko ndani na kichwa kuuma. Sasa kama hiyo kule kuchomeka kumeanza sasa, nazihisi hata mimi sina maana vile. Mimi nimekubali kwenda hospitali kwa sababu huu ugonjwa nilijua sasa si dawa ya yule ya kwetu, si kurogwa. Naona ikifika hospitali mimi nitapona tu. Sasa ndio sasa hivi nimeamua hata kama ni leo niende nijue hii imetoka hii.
In terms of neglected tropical diseases, we still see those diseases quite a lot. We understand from WHO we have about 21 neglected tropical diseases. In Kenya we have about 16 neglected tropical diseases. So the list is long, but the common ones we see from snake bites, we see from lymphatic filariasis cases, all of which encompass common things such as hydroceles. Yeah, based on epidemiological studies and information, the coast region is endemic for the parasites that are related to the diseases such as lymphatic filariasis. Yeah, but there are other neglected tropical diseases that we see, but they are not so common. Lymphatic filariasis is quite common. So from last year, after the training, I've been able to carry as many procedures as I think about 50 or so here in Samburu alone. So we've done quite a lot, and it is with help from our partners, the Amref. So we usually screen for this active screening of these cases from the community. So we liaise with the community health assistants, the CHAs, and the public health officers that go around and basically hunt for these patients. We give them information about this disease and how it can be managed, specifically the hydroceles, because the hydroceles around here are quite common, and most of the men, it had a lot of social implication, let alone the economical productivity of these guys that was badly affected. So we've been doing active screening. We get a number of these guys and then plan for them on how they can be operated on. And then after that, it's usually, most of them, it's a life-changing experience for these patients.
Huu mshipa wangu ulikuwa na miaka, nasikia kuchelewa kwa upande wa pesa, lakini nashukuru juzi nikaja hapa Samburu, nafikiri nikafanyiwa operation, haukuleta shida, na nikakaa zile siku kukaa pale, nisizutembee kwenda mbali. Nashukuru nami nimesikiza mambo ya daktari, nimekaa pale. Baada ya miezi fulani ndio nikaanza kutembea kama kwa ndugu yangu pale, nyumba kama pale na nyumba kama pale. Haya, sasa saa hii najisikia sina shida, niko sawa, nasikia niko sawa kabisa.
Kwa maisha yangu hapo mwanzoni nilipatwa na huu ugonjwa, nikapitia hapa hospitalini, nikafanywa operation kwa upande wa kulia, alafu ikarudi ikanirudia upande wa kushoto. Niliposikia hili shirika linakuja, mimi nikapasilia, nikaandikishwa, nikaja hapa hospitalini, nikafanywa operation. Mpaka dakika hii sisikii lolote, nalima, nakimbia, mnaona, hata kupanda mnazi napanda.
Mimi mwanzo niliambiwa kumekuja madaktari, mimi nikajipeleka mpaka hapo kwa daktari. Ikifika wenzangu wameingia hapo, watu wa Lungalunga, wa Mazera, wa wapi, foleni kubwa. Mungu akajalia nikawa na bahati, nikaandikishwa jina langu, namba ya kitambulisho, namba ya simu na makao pale ninapoishi. Kaambiwa wewe nenda zako ukangoje message. Lakini kabla ya hapo, nilipoandikishwa pale nikaambiwa nenda kwa daktari uko ndani. Kaenda akafungua nguo zangu zote, nikabaki hivi uchi. Daktari akanipima, akaniambia sasa wewe nenda ukangoje message. Ukishapata message utakuja. Unaona? Sasa nikaenda nyumbani. Kakaa siku ya kwanza, ya pili, ya tatu, kapata message kitu saa 9 mchana. Sikuaga mtu hapo, kwa sababu mimi mwenyewe najua na promise na madaktari kule. Kifika hapo, wale wenzangu walioregistriwa pale wote wako. Karegistriwa tena, nikapawa kitanda pale, kaona na daktari, nikapawa kitanda. Kaambiwa kesho utafanya operation, usile kitu. Kwa kweli siku hiyo saa 9 sikula kitu mpaka asubuhi. Asubuhi, ilipofika asubuhi, saa 1, saa 2, mtu wa kwanza, wa pili, wa tatu akawa mimi. Kafanya operation vizuri, tena kwa raha, naongea kama hivi ninavyoongea hapa. Hamisi, unasikiaje? Sisikii kitu. Hamisi, unasikiaje? Sisikii kitu. Naulizwa tena hivyo hivyo tu, kazi inaendelea, sina habari. Alafu nilipomalizika hapo nikaambiwa, Hamisi, tutarudi kwa wodi. Pale kwa wodi ni kule, kakaa siku 2, ya 3 nikatolewa, kaenda nyumbani. Sasa ikawa naenda kwa check up tu, kuangaliwa mpaka ile bandage ikaanguka yenyewe. Naangalia kidonda pale, unaendelea vizuri. Nikapawa miezi mingapi? 4. Nilipawa miezi 4. Kaambiwa usiinue vitu vizito, usifanye kazi ngumu, nikiwa na mama pia muhepe. Nikakubali kwa sababu nilikuwa ninaniumiza, ule ugonjwa unaniumiza. Basi nikaishi mpaka nilipomaliza miezi yangu 4, nikawa mtu wa kawaida. Kashukuru, alhamdulillah.
We realized that some people will have a hernia and then some years later will develop hydrocele. Or some will actually have a herniorrhaphy done and then later they may present with a recurrence of the hernia and hydrocele. So we strongly feel that these two are connected, and probably it might be necessary to take care of both patients who have the hernias and the hydrocele, because we're also asking ourselves, why is it that there are so many hernias here in Kwale County as opposed to other counties that are probably towards more in the mainland? Yeah, for example, counties around Nairobi and such areas. These diseases have been neglected. And then since there's a lot of stigma, these people will hide their conditions. So basically, someone will have a hydrocele for a very long time and they don't want to disclose that. Or even if someone knows a relative who has it, that relative is not ready to accept it because they will feel as if they'll be marginalized. So that's why we felt the need to come in and help these people, so that at least they get the treatment. And also those many misconceptions that are there, people feeling that probably if surgery is done, they may die. At least we wish that if we do surgeries on a number of people, those people can be ambassadors to others. And then we'll have more coming out and saying that, yes, I do have a hydrocele, and if a surgery is done on me, it's fine.
One major thing that really needs to be done, and it's actually awareness. Awareness will change everything, because there's the clients who are remaining with the disease. Their main issue, apart from finances, of which finances are already catered for because Amref partners are willing to pay for the surgeries, it's actually awareness and accepting that the disease that you have can be curable, can be cured through surgery, and the surgery is safe.
Through constantly engaging them and having their fellow community members that have been selected as the community health promoters, coming to constantly persuade them to go and seek care. We've seen more and more patients coming out to seek surgery, and this is largely because, one, we are able to shoulder them from the financial burden of the surgical process, but on the other side is they've seen some of the cases that have already undergone surgery, the life transformations that they've undergone, and they're able to go back and engage in meaningful economic activity. So more and more people are coming out.
Men who've had scrotal swelling and carrying the heavy burden, see a man that's swelling bigger than 20 liters jerrycan, to see them get relief, for me is a big success. It's a big success.